For years now, GP pensions have been a shambles with missing contributions, incorrect paperwork, and unnecessary bureaucracy that costs GPs like me hours of time and has led to many GPs losing faith in the NHS pension scheme. However, it doesn't have to be like this. And today, we're going to present our manifesto on a few things that we think could be changed to improve this situation. And if you're listening on the podcast, we have some links in the show notes to help you. And if you're watching on YouTube, at the end of this video, we'll show you links to three separate resources. One, which is for anyone with an NHS pension who's looking to understand more about it. One, which is specifically for GPs to help them navigate the NHS pensions portal, and one to clear up any questions that you have about McLeod. And to join me for this manifesto or rant, as you might call it, is Medic's very own independent medical accountant and NHS pensions expert, Mr. Andy Powell.
Yeah.
Andy, start your rant.
Hi, everyone. Yeah, this is well, it's not my favorite topic, but it's something that's dominated my life now for far too long. And that's the issue around how GPs get their pension records updated, or in fact, in many cases, don't get them updated. And to me, life could be a lot simpler than it currently is. It's probably just worth explaining where we are now, how we get to this current situation. And really what we're going to do is focus on salary GPs and partner GPs, or indeed partners who are non-GPs, but partners in their practices. And they have to submit an annual return each year called a Type 2 pension certificate for salary GPs and a Type 1 pension certificate for partners. That has to get submitted in England to PCSE. And I would say at this point, PCSE get a lot of flack out there, and they are just part of the system. And as probably trying to explain within this manifesto, it needs more than just PCSE to make changes. It needs a wholesale change in the system. But essentially what happens is every year it takes an absolute age for a combination Department of Health, NHS England, NHS BSA, who deal with the actual pension processing form side of things, and PCSE have to sort of sit down and agree the format of these forms. And, if you think about it from a tax return viewpoint, your tax return comes out on the 6th of April each year, following the 5th of April, end of the tax year, because they know the tax rules. Well, the pension rules are based on your taxable income. Therefore, to me, actually, those pension forms should be available at that point in time. In fact, what we've happened last umpteen years, and as long as I remember, because I go on about this every year, they come out around about December each year, just as, poor accountants, accountants union here are submitting loads of tax returns. So we're not going to deal with things quickly. And it then leads to a massive rush in February to submit everything. So assuming that's all happened, complex form, I think the Type 1 form peaked at 14 pages, just to show how complex it was. That gets processed, hopefully, if everything agrees, hopefully. And then around about August, if it's done by August, then your pension record PCSE will update NHS BSA with your pensionable income. And hopefully at that point in time, your pension record will be updated. But if you think about it from a hospital consultant viewpoint, a hospital consultant, so may well have just finished the tax year, ended 5th of April, 2025. Their payroll will submit the information probably by July, and their pension record, hopefully, will get updated in August to 24-25. For a GP, you'd be lucky by August 2025 to have the 2023-24 year updated. It takes way too long. So it goes through all that process, and it can fall down on a number of different reasons. It can fall down just because of simple processing errors. And, you might think it's automated. It is not automated. It involves keying in of data. It can fall down on something called, a real archaic thing called GP Solo. And have you ever come across GP Solo, Tommy, at all? Yeah, you have. So what GP Solo is, it was invented back in when the new contract came out in the early 2000s. It was invented to try and make sure that if a GP was working for an outside organization, maybe like an out of hours provider, or maybe doing appraisals or something like that, so not working poorly for their practice, that organization contributed to the employer's pension contributions. So when you work for that kind of organization, they have to complete GP Solo forms. So you end up with a multitude of form filling, which if it's not recorded properly by PCSE, then that can lead to some significant problems because things don't reconcile. So it takes an age, it can fall down, and then records get lost, etc. But it's not automated enough.
Yeah. So just to recap, Manifesto number one is produce the forms earlier, not in December, and great reasons for that. It's so frustrating as well for GPs because we can't do any effective planning when we don't know the figures. And of course, you can get an expert to model your pension, etc. But it's just very frustrating. Point number two, are we just saying abolish the GP solo?
Yeah. So yeah, point one, absolutely. These forms should be available now. From an accountant's perspective, you think about your accountant does your accounts, your accountant does your tax return, and then there's a gap before your accountant can do your pension. It's all the same data. Let's do them all at the same point in time. We get into PCSE earlier. It means PCSE are processing things far more smoothly across the year rather than getting this just deluge in February, and everyone isn't as stressed. So things can get updated earlier. Abolish GP Solo. Absolutely needs abolishing now. It's just too complicated. It slows the whole process down. It causes problems. And this is where PCSE have got a real point. They get flack for things going wrong, but actually it's sometimes the paperwork of the out of hours organization, whatever, that's wrong. Or, most commonly it was PCTs, CCGs, ICBs just don't get it right. So if you just take that complication out of the system, you don't have to worry about it. It then becomes quite simple. You've just got contributions that have been paid through the practice. So I would do that. But the next thing I think is really crucial is at the moment, so PCSE have this online portal where you can actually enter all the forms. So you can enter your type 1 form and type 2 form. You can't do for the 2023-2024 year because it became too complicated. So they just abandoned it at that point in time, but it will come back. And what you do at the moment is you just take your type 1 form and enter all these, what were 14 pages, I think it's down to 10 pages now, enter all that information on the system. How much of that information do you think PCSE use? They use one figure. Okay. They use the pensionable profits figure. That's all they're interested in. Okay. So at the moment, if you submit your tax return through a spreadsheet, it will get manually entered at PCSE's end, and they will just take the pensionable profit figure. Why can we not have an automated system where a GP just goes in once a year, confirms their pensionable profit figure, maybe uploads the calculation that goes with it, but doesn't have to type it all in, but just enters one figure, and then it will get processed automatically through the system, taking out the human contact altogether. We're in a modern age where we've got robotic technology that can do amazing things now with numbers, yet we've got a manual data entry system that goes on, which is just ridiculous. So yeah, point number 3 to me would be, let's get this automated. That may need a bit of investment. So that may need Department of Health, NHS England to say, right, enough is enough. We're going to invest in you to sort this out and get this done once for all. It will only sort stuff going forward. It won't necessarily sort the past out, but it will at least mean going forward, life is a lot simpler for everyone.
Alrighty, good rant. Manifesto so far. Next point is kind of related to some of the above, which is more regular updates between PCSE and NHS BSA.
Yeah, so at the moment, effectively what happens is once a year, August time, this data gets uploaded. So if you miss the cutoff date, then you have to wait for the next one to come along, or you have to kind of force a manual update. They have been doing it more recently in December, try and catch everyone up. But, why we just can't do this on a more regular basis? Why does it have to just be once a year? If we've got a batch of 1,000 returns that have been processed in May, well, at the end of May, why can't we just update that information at that point in time? Because if you do that, that then triggers the point where your pension record gets updated quicker. I appreciate the NHS pension is a complicated thing. It's got lots and lots of people involved. Got 1.5 million people within the NHS pension scheme. So, designing a system that's perfect is difficult, but actually more regular updates just seems simpler to me, less likely for things to go wrong. So that would be also, if we get all those basics of the completion of the data right, then yeah, updating more regularly would also become the next thing on my list.
Okay. point number 5, and I no idea why we left this down to point number 5, because it's one of the most nonsensical things about the NHS pension for GPs, as far as I can tell, and that is annualization. So for those that are not aware, tell us what is annualization, and then it will become abundantly clear why it makes no sense.
Yeah. So this is just way stupid, particularly when it comes to locums. Locums particularly are affected by this ridiculous rule. And it applies to GPs, and it applies because of the way the practitioner scheme works. And basically, if you remember, any doctor has to pay a pension tiered rate of contribution. So there's various pension tiers. The highest one's 12.5%, which you pay if you've got pensionable income, I think above 62,000 there or thereabouts. But then there's a whole list of other tiers below that. And if you jump to the next tier, you have to pay the higher percentage. So generally, the logical thing to me, and probably to anyone outside the NHS, would be if I earned £30,000 across a 12-month period, that would be my pensionable pay, which it is. That's the pensionable pay that goes to create your pension. And to me, the pension tier should be based on the fact that I'm actually having my pension updated by £30,000 worth of income. No, that doesn't apply. Okay, so what applies is actually you have to annualize that. So if you have any breaks in service in that period, you have to kind of work out what your annualized pay is. And I'll give you a really, extreme example. Okay, so if you have someone who's a GP locum and decides they are going to work one session a year, okay, and say 1 day a year, and they earn in that day £500. Now, what you have to do is take that £500, so that's 1 day of the year. Let's multiply it by 365 days to get actually what we think your theoretical income figure is for the year. So in that case, it will be some ridiculous figure, and you pay the tier based on that. So you've got to do this whole calculation to work out your pension tier. Let's scrap it. It's not reasonable. If your pensionable income is 30,000, let's have it. You pay the pension tier based on 30,000. It doesn't matter if you earn it in 3 months versus if you earn it in 12 months. That's what your pension is going to get updated by. Let's pay the right level of tier. You take this out, it takes out another complication. To be honest, I haven't come across anyone who really thinks this is a good idea. PTSE, to be fair, just absolutely, get fed up with it because they've got to train all their staff every year in the updated annualization calculations. And to them, they then get a lot of grief when they're coming back to people and saying, no, we think your rate's different. Well, it's not their fault. They're just trying to follow the system. So let's get rid of that altogether. That would be my.
Yeah, awesome. And the final point, which we kind of mentioned already about investing in the system.
Yeah. So, you have to remember that the PCSE do more than just GP pensions. They do GP pay, but they also do, ophthalmology, pharmacy, and all kinds of things, all kinds of the healthcare sector. They deal with things related to that. And it's not just about the finance side, it's about patient records, et cetera, et cetera. They do a whole raft of things. In terms of them investing in the system, what they have to do is they have to react to what their employers tell them to do. And their employers are effectively NHS England, straight to the Department of Health. So if the Department of Health say, actually, I want you to concentrate on, the pharmacy sector this year, they will have to concentrate on the pharmacy sector this year because that's what their ultimate customer asked them to do. And you have to bear in mind, this is an outsourced service, which NHS England outsourced however many years ago. So, they've got, they're a private provider providing a service for the NHS. So they will do what their customer wants them to do. So we need, frustratingly for me, too often GP pensions gets to the bottom of the pile. We get to the situation where, we get talking about amendments, things to make it better. And for whatever reason, something comes along and it gets more prioritized and time runs out and it never happens. So we run over to next year, stuck with the old system. I would like now, if we're going to look at this whole exercise in the NHS of reducing admin issues and reducing all those, points where things don't work, I would like the NHS to make a one-off investment now in ensuring this is completely simplified, completely automated, and works for the future. Because that will sort the future out. And as I said, there will still be effort needed to sort the past out, but they will start over time will disappear and we'll have a far better system going forward and a far simpler system.
Okay, so that is our manifesto, and we hope that some of that gets implemented. But the question is, what can you do about this now? Because we are where we are, and GPs have pensions, which they need to get sorted out now. And so we have a ton of resources here at Medics Money to help you navigate what is essentially a failing system. So, of course, we have our Medics Money courses. So you go to our homepage, click on our courses, and we have courses for all doctors who are interested in improving their finances. So that's the Medics Money Financial Wellbeing course. We have the Medics Money Business for GP course, which is to help GP sort of registrars and learn about the basics of GP finances. And for GP partners, we have the GP Partnership course. And on all of these, we will cover how to navigate this and loads of other financial issues that doctors and GPs face. So that's one option. If you're watching on YouTube, then I'll put a link to a video for anyone who has an NHS pension where we explain the basics, what's the difference between the different sections and when can you retire and how much will you get. And that'll be up there. I'll put a link to a specific guide to using PCSE's own pensions portal down there. And finally, for those of you that are interested in McLeod, I'll put a video in this corner on McLeod. But if you also go to our homepage, you land here, and you go, I need information on a specific topic, click on the McLeod judgment, that will spin up. And we have all of our McLeod resources just waiting to help you there, because McLeod is another rant, which we could go on today, but I don't think we should, because maybe it'll get sorted, maybe it won't. But thanks for your time today, Andy. Any further words of wisdom?
Yeah, sorry, I've just remembered I'm going to add something extra to my manifesto, because you've just promised me, if you go into one of our courses and you want to pay for our courses, you can do that through our website, okay? Which you can do through most things you buy online. So, if you go back to pension returns, particularly locums, for example, this was meant to come in and it hasn't come in. They have to submit the forms. They have to make the payment over to NHS England. Can you click on a button in the site that says pay now and pay those contributions? No, you can't. Life's moved on. Technology like that should be pretty simple these days. So let's also have a pay now option. So allow people to clear their liability with a card and clear their debt.
Could even have Apple Pay, like the Medics Money courses have, where you just one click, one finger on the button or face in the frame, and you are paid up. But we live in hope. So hopefully that helps you, and you've got a whole load of resources to help you there. I'll put the links to all of them in the show notes, and hopefully this video will become redundant in the future, but I've got a bad feeling that it won't.
Yeah, I think this video might last the length of my hair, which is rapidly disappearing as the years go on. So this will still be around in the future.
Awesome. Thanks, Andy. Take care. Don't forget to like and subscribe if you like more of this type of content as well.